Good day, everyone. I am Dr. Eileen Lee, and I will be talking about herpes zoster vaccine. Before I begin, let me share to you the following disclaimer. The target audience for this talk are specialists, general practitioners, and allied health professionals. The evidence summaries are based on the best available scientific data at the time of formulation of the guidelines, and there may be limitation in some aspects of screening the information. I will be sharing to you the executive summary, which were gathered in answering the 8 identified clinical questions. We applied the widely accepted grade approach evidence detection framework criteria. These recommendations will be updated every 3 years as new evidence becomes available. The next slide will show the basis used to assess the quality of evidence through the grade approach. Herpes zoster infection as a vaccine-preventable disease. The target population are among apparently healthy individuals 60 years old and above. Herpes zoster is often underreported and unrecognized early in our setting. Thus, the true burden of this disease in the country is unknown. There are 2 available preparations globally, namely the live attenuated vaccine and the recombinant vaccine. Evidence showed higher efficacy rates with RZV. Herpes zoster vaccine posed financial accessibility issues with a market price of 6,000 to 7,500 pesos per shot or 4,500 pesos when procured in bulk. Evidence on the cost-effectiveness of herpes zoster vaccine included studies conducted abroad posing applicability issues. The disease is caused by the reactivation of varicella virus in the dorsal root ganglia. There leads to the appearance of a vesicular rash in a single dermatomal distribution that frequently involves the trigeminal, cranial, and cervical nerves, while the lumbosacral nerve involvement is less common. The individual's age, health, and immune status affect the presentation and course of herpes zoster. In a study done in the US, the incidence of herpes zoster are the following for each specific age group. Around 3% are hospitalized. In the US and Europe, mortality rate is around 0.25 per million population, and the incidence in the Asia and the Pacific countries are similar to the Western countries. We will now discuss the efficacy and safety outcomes of both the live attenuated herpes zoster vaccine and recombinant herpes zoster vaccine versus placebo. There were a total of 13 included trials, which enrolled 69,916 participants comparing herpes zoster vaccine versus placebo. 10 of the 13 trials studied the ZVL or live attenuated vaccine, whereas the 3 other trials studied the recombinant zoster vaccine or RZV. Out of the 10 trials on ZVL, only 1 trial, namely the shingles prevention study by Oxman et al., which was published in 2005, evaluated the incidence of herpes zoster virus infection. The study was followed up for 3 years and reported a significant reduction, which was seen in this vaccinated group. Meanwhile, herpes zoster-related hospitalization was inconclusive, and the herpes zoster-related mortality is not significant. For the RZV versus placebo study, the incidence of herpes zoster in a 3.2-year follow-up favors RZV versus placebo. Vaccine efficacy for the prevention of post-herpetic neuralgia among patients more than 70 years old was 88% in the study. Herpes zoster-related hospitalization and mortality were not significant. Serious adverse event and systemic adverse event for ZVL versus placebo were inconclusive. Meanwhile, local adverse events such as redness, pain, and swelling favors the placebo group. These reactions were generally mild. Serious adverse event in the RZV group versus placebo was not significant. Local and systemic adverse events favors the placebo group. Cost is an important factor for accessibility. As of this writing, the unit cost per vaccine for ZVL ranges from 6,000 to 7,500 pesos per dose and may be lowered to 4,500 pesos per dose if procured in bulk. At present, there are no local studies done on herpes zoster vaccine. The herpes zoster vaccination coverage is suboptimal at around 30%, and this is partially attributed to out-of-pocket costs via co-payments. Here are the recommendations from other societies. From the Philippine Society for Microbiology and Infectious Diseases 2018 Handbook on Adult Immunization, they recommend Shingrix for adults more than or equal to 50 years of age for the prevention of herpes zoster and other related complications, irrespective of prior receipt of varicella vaccine or a live attenuated herpes zoster vaccine. Zostavax for immunocompetent adults more than or equal to 60 years old without prior history of herpes zoster to prevent the disease. Zostavax for immunocompetent adults more than 60 years of age with prior history of herpes zoster infection to prevent the recurrence of the disease. There was no mention of the recommendation of herpes zoster vaccine for healthcare workers. From the Advisory Committee on Immunization Practice, US-CDC 2018, Shingrix or RZV is recommended among immunocompetent adults aged more than or equal to 50 years, irrespective of prior receipt of a varicella vaccine or a herpes zoster vaccine. Zostavax or ZVL remains a recommended vaccine for prevention of herpes zoster in immunocompetent adults aged more than or equal to 60 years old. However, there were no recommendation of herpes zoster vaccine as part of the routine vaccination for healthcare workers. From the Australian Technical Advisory Group on Immunization last 2018, which was updated last 2021, it recommends vaccination for immunocompetent people from age 60 years, and vaccination from age 50 years can be considered. Shingrix is preferred over Zostavax from age 50 and above for prevention of herpes zoster and its complications due to its higher efficacy, given as a 2-dose series with an interval of 2 to 6 months. Single-dose Zostavax is an effective alternative vaccine for adults aged more than or equal to 50 years who wish to reduce their risk of herpes zoster. And it is still not part of the recommended vaccines for healthcare workers. From the World Health Organization, herpes zoster vaccine is not part of the recommended routine immunization for any age group, whether it may be elderly, age 50 to 60 years old, and healthcare workers. Herpes zoster vaccine is a safe and effective preventive measure for reducing the overall burden and severity of herpes zoster in older adults. Adverse reactions are minimal and well tolerated. Given the low rate of herpes zoster immunization, the advocacy of physicians taking care of these patients may play an important role in increasing the vaccination rates in the future. And with that, I would like to thank you for your kind attention. Have a good day.